All right, this is a heat map that we have been showing every week, and this is about the level of transmission that we saw 2 weeks ago, and then last week there was a 1% rise, and then now we're back down to where we were about 2 weeks ago. We're still seeing almost 94% of all counties in the United States are in the high transmission rate. And this is a interesting graph, and it shows that, let me get my laser pointer here. It shows that over time, how many counties are in high transmission, substantial, moderate, or low transmission. And so like back in May, June, Walla Walla was one of those high transmission counties. And you can see that over time, the majority of the country turned into a high transmission county. This is from the CDC, and this kind of shows a heat map of high transmission counties, and it also ranks counties. And Washington State ranks 30th out of 52 counties with case rate. This is a case rate curve for the United States, and the blue lines are daily cases, and the red line is the 7-day moving average. And we've mentioned over the past week or so that there appeared to be somewhat of a plateau and maybe a partial decline in the case rate. But as you can see, it's still at extremely high levels. The CDC does present some forecasting information, and the forecasting information suggests that that we're somewhere around the peak of this wave. However, if you look at this graph, this process doesn't abruptly end. It takes, weeks and sometimes months for this to unfold. And even looking at the winter time peak that we had, this whole process went from October to March. So, this process can take weeks and months to happen, but we're hoping and praying that things will start to flatten out and decline. We've talked a lot about hospitalizations locally and nationally. This is a heat map showing hospitalizations, hospital admissions due to COVID nationwide. Washington State ranks 23rd out of 52 with regards to hospitalization rate. But as we mentioned a visit or two ago, we are one of 4 states, one of 5 states that have had the highest hospitalization rate that we've seen since the start of the pandemic. And hospitalizations is really the main message that we've been talking about over the past several weeks, the need to decrease cases to decrease hospitalizations. This is the Washington State case rate curve, and this was as of yesterday, what was published as of yesterday. And as you can see, there's a hint that things are starting to plateau. But as we've talked before, sometimes you can get a plateau, maybe even a decline, but then you can also get a peak after that. And that's much more clear when we look at our Walla Walla curves that we've experienced in the past. This is a Washington State slide, and once again, it just shows how this state just transformed into a high transmission state. We've mentioned before that hospitalization rate in Washington State's very high. The highest has been throughout the pandemic. That's for the Washington State. This is also a Washington State slide, and it shows that all age groups are being hospitalized. For instance, we'll look at this orange bar. 18 to 39-year-old age group is a substantial group that's being hospitalized due to COVID. The lighter orange are suspected admissions. Same thing for the age group above this, 40 to 69, a very large group of people. And so, every demographic, and we've talked before about how vaccines decrease your risk of severe illness. hospitalization and death. So every demographic would benefit from getting vaccinated. But if you look at, over 50% of these cases are that 18 to 69-year-old range. So, it's really the meat of all these cases and hospitalizations. So last week in Walla Walla, we had 5 mobile clinics and 3 Southgate clinics, and out of all that, we delivered 263 vaccines. So we're still, concerned about return on effort, but we are committed to continuing to be available for our community. And just a reminder that the vaccine lottery starts tomorrow, and there's information from the Chamber of Commerce about that. The Walla Walla case rate curve, again, there's a hint that things are starting to plateau a little bit. We, even as of last week, we had a sense that some of the numbers were a little bit lower, but we also mentioned that it a lot of times takes more time to get a sense where things are going. And as I mentioned earlier, you can still have a plateau, even a drop followed by another spike. Over the past several days, we have seen an increase in our daily cases, and we'll see where that goes. But it could be concerning for a continuation of our case rate rise. This is our Walla Walla hospitalizations per 100,000 over 14 days. Again, it peaks and troughs. Over the past week, we have continued to see somewhere between 20 and 24 patients, COVID patients in the hospital at any one time. We do publish that data when it's available. We haven't received data from today, but as of the 10th, once again, it shows that the majority of the patients that are hospitalized are unvaccinated. So on September 10, we had 22 patients in the hospital. 20 of those were unvaccinated. We had 4 in the ICU. All of those were unvaccinated. We had 1 patient on the ventilator, and that patient was unvaccinated. So it just highlights the importance of getting vaccinated to keep yourself safe from severe illness, hospitalization, and death. So, time will tell, but in general, there might be a slight flattening of the case rate curve, although, as I mentioned, Walla Walla might be ticking up a little bit, but we'll know over the ensuing weeks. And the main theme that we've talked about over the past several weeks is just the strain on our hospital system. And it's not just our local hospital system, it's regional. Certainly statewide, but also the states surrounding us. And so access to care for everyone is a major issue. And so, so what are the tools that we have to protect us from all this? And to protect the hospital system, first protecting ourselves. And we've talked about the importance of getting vaccinated, but also just slowing the spread by masking and the social distancing. And the hospital system has seen a surge of people visiting the emergency room, so we're encouraging people just to go to the emergency room for emergencies, and to avoid risky behavior that could result in a trip to the hospital, and continue to stay in close contact with your primary care provider and for your ongoing care. So that is my report.